Hello, everyone. My name is Mari Galle, and I am the Oncology Acupuncturist at Cancer Rehab and Integrative Medicine. I'm happy to be here today, and I look forward to speaking with you a little more about integrative medicine, acupuncture, and its relation with lymphedema. Just a bit of a background. I have a Bachelor of Science in Biology with a concentration of biomedical science, nutrition, and Spanish. I then earned my master's in acupuncture and oriental medicine. And this means that we studied 4 pillars in our education from acupuncture, herbal medicine, biomedicine, as well as mind-body practices of Qigong and Tai Chi. I then earned a doctorate of acupuncture and Chinese medicine and had a specialization of oncology acupuncture. So this means that I have advanced training in acupuncture and specifically for the safety and efficacy protocols for oncology patients as they're going through treatment and into remission, treating the side effects and symptoms that go along with the diagnosis. Today, we are going to talk a little bit about what is integrative oncology, what is acupuncture. I want to discuss a bit about Tai Chi and Qigong, some movement practices that you can do, acupuncture and lymphedema, and we are also going to address some safety concerns. Integrative oncology is a patient-centered, evidence-based field of cancer care that utilizes mind and body practices, lifestyle modifications from different healing traditions alongside conventional cancer treatments. And I always like to start out explaining this because I want patients to understand that we are not alternative medicine. We are complementary medicine where we integrate our modalities with modern traditional oncology treatments. So we work alongside your oncologist and we help you navigate any side effects and symptoms that might come along with your treatment, surgery, post-op, chemo, radiation, immunotherapy, etc. So I do want to stress that integrative oncology is the practice of using multiple modalities alongside conventional cancer treatment. And these include nutrition, meditation, oncology acupuncture, oncology massage, physical exercise, yoga, Pilates, cardio, Qigong, and Tai Chi, among others, physical therapy and rehabilitation, reflexology, aromatherapy, oncology aesthetics, and counseling. If you are interested, if you are in the Austin area, there are wonderful integrative oncology services in town. And if you're not in the Austin area, you can go to the Society of Integrative Oncology's database. There are practitioners and oncologists who are part of this organization, and you'll be able to find someone hopefully near you. It's integrativeonc.org. So what is acupuncture? Acupuncture is the insertion of hair-like thin needles that are placed on specific points of the body, and they encourage healing and create a response from the nervous system. There's over 500 acupuncture points that we study, and a combination of points or protocol or prescription of points will be used for each individual to treat whatever your concerns may be. So everyone's treatment is a little different. This is a very individualized medicine that we practice. Acupressure is the practice of holding or pressing, massaging specific points on the body for 30 seconds to 2 minutes at a time in order to stimulate a response from the nervous system. Acupressure isn't quite as strong, won't cause as strong of an effect that acupuncture does, but this is something that you can practice at home, and you're able to practice self-care. If you work with your acupuncturist, they can teach you specific points to help with specific side effects or symptoms you're experiencing. And these are acupressure seeds. Acupressure seeds it's a little tape with a seed or a little BB that can be placed on specific acupuncture points. For instance, there's a point on the hand for pain, and you can press this or put a little acupressure seed on here and leave that on for 2 to 3 days at a time. And this can really help just with general pain in the body, headaches, joint pain, etc. So when you work with your acupuncturist, you can ask them if they have any acupressure seeds. You can buy these online. There are wonderful acupressure point descriptions. You can like educational books, or hopefully your acupuncturist can teach you or send you home with these little acupressure seeds just to keep your treatment going after you see your acupuncturist. And again, these can be purchased on Amazon. And if you do feel uncomfortable placing the acupressure seeds yourself, ask your acupuncturist to put them on right before you leave your session. I prefer being able to do this for my patients because there are 500 points, and one can be difficult to find the exact point, but it can be done at home too if you work with your acupuncturist to help you. Qigong is another practice that we study. It is a practice that combines body movement, relaxation of the muscles, meditation, and breathing exercises in order to improve mental, physical, and emotional health. This helps patients with a wide variety of concerns. For cancer patients and lymphedema patients, it can help with fatigue, insomnia, pain, anxiety, and even neuropathy. There is quite a bit of research being done with Qigong and its benefits. So this is something that I encourage all my patients to do. You can do it at least once a day. 1 to 2 times a day is great. Or if ever you just need some grounding, or if you have a stressful moment in the day, you can sit down and do some Qigong for 5 to 10 minutes. There are wonderful resources for Qigong at home. Currently there are classes in Austin. They're all online with Zoom because of COVID, but hopefully later into the year, they'll be able to resume in person. Until then, you can go to the West Bank Community Library. They offer free online Qigong classes. There's wonderful YouTube, just a simple YouTube search will bring up plenty of classes. And it's really something that you can do either seated or standing. It's very beneficial. It's helpful for circulation. It's wonderful for pain and energy. It'll just help you as you navigate your treatment with lymphedema. I wanted to do a little bit of Qigong here. Since we've been sitting and listening today, let's see if this will play. And I'll bow out here for a second and we'll do some Qigong as everyone is seated. If you want to put your laptop or your iPad, scoot it back a little bit and sit wherever you're sitting, sit on the front of the chair, and we can follow along. This is Master Li. He's doing something called Shenzhen Qigong. Simple 6 minutes that we're just you can either watch or try following along. So Master Li is focusing on his breath, breathing in when he's reaching backwards and opening up his arms, and then breathing out as he's bringing his arms together. And as you watch, just the breath work with the movement being in sync is important in Qigong. Here's the second one. We're almost done. Last one. Okay, so that is one example of Master Lee's Qigong. There are many other, as you can see, there's standing ones, sitting. There's a lot of group. When COVID is over, there'll be quite a bit of group. Sorry, here we go. Group Qigong back in Austin. So I'm looking forward to that. We also have Tai Chi. Tai Chi is a traditional Chinese practice in martial arts. It involves a series of movements coordinated with the arms, legs, and your breath again, in order to benefit balance, circulation, and mind-body strength. Studies have shown that Tai Chi can improve muscle strength, balance, relaxation, flexibility, stamina, and mental health. It's wonderful for circulation and pain management as well. There are resources at home for Tai Chi. Memorial Sloan Kettering is a cancer hospital or cancer center in New York, and they offer free Tai Chi videos online for cancer patients. So you're more than welcome to go on. There's a link here, and you'll get this. You will get this slideshow after the seminar is over. But there is a link where you can see the videos where the gentleman explains everything. There's longer videos as well, or you can always just do like a short 20-minute Tai Chi movement in the morning or in the evening. There are also many Tai Chi courses available online outside of Memorial Sloan Kettering. And in Austin, there are quite a bit of groups that do Tai Chi outside. Sometimes there's a fee associated and sometimes there's not, but that's something else that you are more than welcome to look into. There is Oncology Acupuncture. So now that we've kind of talked a little bit about acupuncture, Tai Chi, Qigong, I want to just discuss specifically Oncology Acupuncture. And research has shown that it can help with various side effects and symptoms related to cancer treatment. Nausea, peripheral neuropathy, pain, stress, anxiety, depression, hot flashes, insomnia, joint pain, muscle cramps, fatigue, digestive issues, and I have a little asterisk next to lymphedema. I'll explain why in a moment. Acupuncture and lymphedema, there is still active research going on regarding if acupuncture is effective in treating lymphedema. There have only been small group studies, and although they have shown promising results, it was not a large enough group study or research to be able to say that acupuncture should be a first-line treatment for lymphedema. It did show that it is safe. So there are many concerns. I know after being diagnosed with lymphedema, you want to take certain safety measures, like not having your blood drawn from the effective side or having your blood pressure taken on the effective side. There has been sufficient research to show that acupuncture is very safe to do on the effective side when it's done by a professional who is well trained in working with patients with lymphedema. So we do know that acupuncture is helpful in complaints associated with lymphedema. So there's plenty of research to show that acupuncture can help inflammation. It calms inflammatory markers in the body. It is wonderful for pain. Acupuncture works on the limbic part of our brain, which calms pain sensors down. And acupuncture encourages circulation throughout the body. Usually acupuncture with any type of chronic condition, it is done in a series of treatments. Most of the time with chronic issues, you need 8 to 10 sessions, 2 treatments for 4 to 5 weeks, 2 treatments a week for 4 to 5 weeks in order to see if acupuncture is right for you. And then in acute situations like acute pain, allergies, a headache, or a migraine, patients generally need much shorter treatments, like 2 to 3 treatments, if that, before they need to come in on like a check-in basis once every couple of months. But the research shown with lymphedema, the preliminary research, patients did get treatments 1 to 2 times a week for at least 5 weeks. And then the research that I'm thinking of, it was in 2013, and I can post that as well. There was a small study of 60 patients, and 30% of the patients did see improvement in their lymphedema. But again, that's not really a large enough study for us to say that it should be a first line treatment for lymphedema compared to the wonderful benefits of like manual lymph drainage, etc. And I already discussed this, but I do want to reiterate that research has shown acupuncture when performed by an experienced licensed acupuncturist is safe for lymphedema patients. Gentle acupuncture needling techniques must be used on the effective side, a few needles and really gentle insertion, but your acupuncturist should know this. There are a few do's and don'ts for acupuncture safety and lymphedema. For your own benefit, if you are interested in trying acupuncture for any other side effects you might have, I would highly suggest that you ask your acupuncturist, or if he or she has experience in working with lymphedema, if when you receive acupuncture treatment, if they have advanced training in oncology acupuncture, they most certainly have had this training in safety protocols. There are at least 3 oncology acupuncturists here in Austin. I can get you in touch if you're interested in trying it. I can get you in touch with all 3 of us throughout the area. Otherwise, we can help find you someone in your area as well. One thing that I do not recommend is trigger point acupuncture or dry needling in the affected region. Thicker needles or more intense needling is contraindicated with lymphedema. One aspect of lymphedema is neuropathy, and acupuncture has shown to be very beneficial in peripheral neuropathy. There are different treatments that need to be done. We can do electrical stimulation on the hands and or feet, as well as just using acupuncture needles. And how this works, acupuncture is inserted into the toes or by the hands, and they're very hair-like thin needles, so this really does not cause pain. But by inserting a needle into that area, we're going to increase blood circulation, and by increasing blood circulation, we'll be able to help heal the nerves to help bring sensation back to that region. So it is very effective in peripheral neuropathy. You do need approximately 8 to 10 treatments minimum for you to be able to feel its full effects, and then potentially check-ins or more after that, just because everyone's condition is a little different. So in conclusion, acupuncture is a safe healing modality when performed by a licensed acupuncturist. It is recommended that you find an acupuncturist with specific knowledge in the safety of acupuncture and lymphedema, as well as oncology acupuncture. Do get gentle acupuncture, but do not receive dry needling or trigger point acupuncture or really intense needling in the area. Other parts of the body is fine, but in the area of the arm or leg where there's lymphedema, that is contraindicated. There is promising preliminary research that acupuncture can improve lymphedema, but more research needs to be done to be able to conclude that it should be a first line of treatment. But acupuncture can treat symptoms often associated with lymphedema, like pain, circulation, and inflammation. Thank you all very much. If you have any questions, feel free to contact me. My business number is listed and my email is Mari, M-A-R-I, @cancerrehabaustin.com.